I am Dr. Mike Belligan. I'm here with Dr. Lloyd Rudy, one of the most famous cardiac surgeons. Dr. Rudy, thanks so much for being with us.
You're welcome.
You know, we don't get the opportunity to be in the operating room, or even most people don't get the opportunity to visit with a cardiac surgeon who has had experiences with people near death, or some who have already been pronounced dead and come back. And so that's what we're going to talk about here, in particular one case, and may touch on another one. Dr. Rudy, why don't you tell us a little bit about that?
We had a very unfortunate individual who on Christmas Day had, from an oral infection, infected his native valve. Okay. If your native valve has the slightest defect, whether you were born with it or you developed it later, it calcified a little and the valve leaflets don't move or whatever, the body recognizes that as something abnormal that it's got to take care of.
Okay.
So that's what happened to this man, and one of my junior partners was on call, and he had to do an emergency valve resection. Once we were able to accomplish the repair of the aneurysm and the replacement of the valve, we could not get the person off of the bypass. Every time the 4 or 5 liters of blood that we were pumping around his body, we would reduce down to 2 or 3, he'd begin to weaken and his blood pressure would go down and so on. And to make a long story short, we simply couldn't get him off the heart-lung machine.
Right.
Finally, we just had to give up. I mean, we just said, we cannot get him off of the heart-lung machine, so we're going to have to pronounce him dead. Right. So we did that. And so the anesthesiologist turned his machine off, and the bellows that were breathing for the patient stopped. That machine was quiet. The anesthesiologist went into the surgeon's lounge. He hadn't eaten anything all day, so he went in to have a sandwich. And the people who usually clean up the instruments and all that were coming in and taking away all these tools. And my surgical assistant closed the patient in a way that a post-mortem exam could be done, because anyone who succumbs on the table has to, by law, has to have an autopsy.
Right.
So he closed him up briefly, just a couple 3 wires here and a big stitch to close his soft tissue. Well, the machine that records the blood pressure and the pulse and the left atrial pressure and all the monitoring lines and things continued to run the paper out onto the floor in a big heap. Nobody bothered to turn it off. And then we put down a transesophageal echo probe, which is just a long tube that has a microphone on the end of it, and we can get a beautiful picture on a monitor of the heart beating. Well, that machine was left on, and the tape, the VCR tape, continued to run.
Right.
Well, the assistant surgeon and I went in and took our gowns off and gloves and masks and things, and came back, and we were in our short sleeve shirts, and we were standing at the door kind of discussing if there was anything else we could have done, any other medicines we could have given, whatever, to have made this a success. And as we were standing there, it had been at least 20 minutes. You know, I don't know this exact time sequence, but it was close to 20-25 minutes that this man recorded no heartbeat, no blood pressure, and the echo showing no movement of the heart, just sitting there. And all of a sudden we looked up, And the surgical assistant had just finished closing him, and we saw some electrical activity. And pretty soon the electrical activity turned into a heartbeat. Very slow, 30, 40 a minute. And we thought, well, that's kind of an agonal thing. And we see that occasionally, that the heart will continue to beat even though the patient can't generate a blood pressure or pump any blood. Well, pretty soon we look and he's actually generating a pressure. No, we're not doing anything. I mean, the machines are all shut off, and we're stopped all the medicines and all that.
Right.
And so I start yelling, "Get anesthesia back in here!" and get the nurses. And to make a very long story short, without putting him back on cardiopulmonary bypass, the heart and lung machine and stuff, we started giving him some medicines, and anesthesia started giving him oxygen, and pretty soon he had a blood pressure of 80, and pretty soon a blood pressure of 100, and his heart rate was now up to 100 a minute. You know, he recovered and had no neurologic deficit. And for the next 10 days, 2 weeks, all of us went in and were talking to him about what he experienced, if anything. And he talked about the bright light at the end of the tunnel, as I recall, and so on. But the thing that astounded me was that he described that operating room floating around and saying, "I saw you and Dr. Cattaneo standing in the doorway with your arms folded talking. I didn't know where the anesthesiologist was, but he came running back in. And I saw all of these post-its sitting on this TV screen. And what those were any call I got, the nurse would write down who called and the phone number and stick it on the monitor, and then the next post-it would stick to that post-it, and then I'd have a string of post-its of phone calls I had to make." He described that. I mean, there's no way he could have described that before the operation, because they didn't have any calls.
No.
Right?
And he's sitting on,
And
he's lying on the, so he must have been floating.
He was up there.
Yeah.
He described the scene, things that there is no way he knew.
Right.
I mean, he didn't wake up in the operating room and see all this
No.
stuff. I mean, he was out.
Right.
And was out for, I don't know, even a day or two.
Right.
While
right.
we recovered him in the intensive care unit. So what does that tell you?
What
does that tell you? Was that his soul up there?
It's hard to know. But
It
certainly brings that possibility into play.
It always makes me very emotional. There have been other instances, like one other I remember so vividly was a guy who was on anticoagulation, medicines that keep you from clotting. And I don't even remember the operation or whatever, but we had to do him right away. And you try and reverse that as much as possible, but it's impossible to completely do it. And we were in there and we'd finished the surgery and we just simply could not stop this person from bleeding.
Right.
I mean, we pulled out every gun in the armory to try and get this
Everything you can
person.
possibly do.
Yeah, and we finally decided we're not going to be able to stop this bleeding.
Right.
And all of a sudden, nobody spoke. Because everybody in that room felt a presence.
Right.
And, I mean, the anesthesiologist and I talked about it afterwards. I mean, there was no question. There was a presence in that room.
Right.
And he stopped bleeding just like that.
How do you explain that? What is your take on that, Dr. Rudy?
Oh. There's something out there that, you know, people with faith believe is there. Some people call it God, some people call it other things, Buddha or Muhammad or whoever. It has convinced me there is something out there.
Something out there. It is so good of you to share this with people who don't get the opportunity to be at those near-death or post-death experiences.
I don't know. It just convinces you that the strings are being handled up here somewhere. I mean, you know.
Absolutely.
And it makes me very emotional.
I can tell. Yeah, it does me as well. And I'm so pleased that you would share this with these people in this video who just don't get that opportunity. Is there any last things that you'd like to say?
Well, just that I presented this case to 13 other cardiac surgeons throughout the country in a special meeting, and they had several similar experiences, not quite as dramatic as the one I had, but everybody that deals with that every day has had those experiences. So it's not just me.
Right. Exactly.
So,
Dr. Rudy, thank you so much for sharing.
You're welcome.